A dental implant is a small titanium post that replaces the root of a missing tooth. It is placed in the jawbone and then topped with a crown or similar restoration that looks like one of your natural teeth. Implants are fixed in place and don't rely on any neighbouring teeth to support them. Bridge work, on the other hand, uses your adjacent teeth for support, which usually means that these teeth need to be filed down. Dentures are different in that they are removable and would rest on your gums for support. Implants are our closest option to replacing a natural tooth in both function and appearance. Most adults are good candidates for dental implants. At our assessment appointment, we will look at your overall health, we will check your gums, we will look to see if you have adequate bone volume and density for an implant, and we will also look at your general oral hygiene habits. Even when bone levels are low or teeth have been missing for a long time, bone grafting or other solutions often make implants possible. The full process can take anything from 3 to 9 months. This is dependent on your healing and whether any additional procedures have been needed. Typical steps for dental implants would include the planning stages, the dental implant placement surgery, a period of healing, and then the final restoration. In all cases, a temporary restoration will be provided during your healing to make sure your appearance is always maintained. The procedure itself is very manageable. Most patients return to normal activities within a day or two with only mild soreness and swelling. Dental implants are designed to be long-term or even lifetime solutions. Our success rate is anything from 95 to 98%. With proper care, implants can last 20 years or even longer. Implant treatment is very safe, but like any procedure, there is a small risks, such as infection, delayed healing, or the implants not integrating with the bone. This is very rare. Careful planning, good oral hygiene, and follow-up visits greatly reduce any of your risks. Implants are cared for much like natural teeth. Brush your teeth daily, floss, or use interdental brushes. We recommend attending regular dental checkups and our hygiene appointments. We also encourage you to avoid any smoking or bad habits, as these can affect your gum health. Yes, once healed, most patients can't tell the difference between an implant and a natural tooth. The implants feel stable and secure. They look natural in shape and also in colour. These implants will allow for normal chewing and speaking. Implants require routine professional care, usually every 6 months. Your hygienist will clean around the implant safely and monitor your gum and bone health. We will check the implant and crown for wear. A good maintenance program will help prevent any implant-related gum disease. If there isn't enough bone, then bone grafting will be recommended to strengthen the area. Bone grafting can be done before or during implant placement. Bone grafting usually may add 3 to 6 months to the timeline. It, however, will increase the long-term success of the implant. If bone grafting is required, we'll explain all options, costs and timelines clearly before any surgery is started.